will move heaven and earth to get more people vaccinated for free and create more places for them to get vaccinated.
An urgent call to action from President Joe Biden to get vaccines into the arms of Americans. Today marks 1 year since the first coronavirus case was reported in the United States in the state of Washington. And now no part of the country is untouched by this virus that has now claimed the lives of more than 400,000 Americans and 9,200 Hoosiers.
Today, President Biden signing several executive orders to fight this pandemic. You're seeing it right there. And Indiana state leaders are telling us tonight what's next in the plan to get you and your family vaccinated. Earlier this evening, we answered your questions in this exclusive town hall on the coronavirus vaccine. It aired right here on Fox 59. And now tonight, we are continuing to get the answers that you have questions for, with team coverage from our local reporters and our correspondent in Washington, D.C. We are so glad you are with us tonight. Thanks for joining us. I'm Fanchon Stinger.
And I'm Dan Spieler. It is President Joe Biden's first full day in office. Today, his administration focused on its strategy to fight coronavirus. The new president signing 10 executive orders on the virus today, including plans to increase vaccines and testing, reopen schools and businesses, and require masks during travel. President Biden criticized how the vaccine distribution has been going so far. His goal is to distribute 100 million doses in 100 days.
While the vaccines provide so much hope, the rollout has been a dismal failure thus far. This will be one of the greatest operational challenges our nation has ever undertaken, and I'm committed to getting it done.
President Biden is invoking the Defense Production Act to increase vaccine distribution across the country. Each state has developed its own plans for distributing the vaccine.
And here in Indiana, we can tell you the vaccine is now being given out by age, as you know. Right now, Hoosiers 70 and older can make appointments. State health leaders telling us tonight distribution is going smoothly so far. More than 360,000 Hoosiers have gotten their first dose at this point, but they thought they say they thought they would be getting more doses each week by this point in the process.
Despite being told that additional vaccine would be coming to states, we've since learned that there is no national stockpile. Our vaccine allocations have not increased beyond the roughly 78 to 80,000 doses we were already expecting each week.
And that information there, that is what's slowing down the process tonight. Indiana cannot offer appointments to more people until more supply comes in. Fox 59's Courtney Crown showing us tonight how the state is adjusting to this news.
Essentially, we are running very close to one-to-one in terms of doses and appointments, which is why we cannot expand further at this time.
Indiana Chief Medical Officer Dr. Lindsay Weaver spoke candidly Thursday about a vaccine supply that's less than Hoosiers hoped for.
We had started to make plans to ramp up, but hadn't put any of those things into place quite yet. So we just adjusted back to what our original plan was based on what we were expecting, which is that close to 80,000 doses a week.
Late last week, state health officials found out there is no federal stockpile of vaccines, and the state is receiving all available doses. Experts say this means Indiana must make adjustments to how many first doses they give.
A simple rule of thumb at this point is if you have 100 doses, you can vaccinate 50 people.
So far, Weaver says about 50% of Hoosiers 70 and older have scheduled vaccine appointments. No one knows when appointments will open up for the next group of Hoosiers 65 and older.
Dr. Weaver and I will be very anxious to get more, and I can assure you we have lots of places for that vaccine to go so we can get it in Hoosiers' arms.
But at this point, the state has not had to cancel any appointments.
You can rest assured that our goal is to ensure that there will be a dose for you when you arrive.
Courtney Crown, Fox 59 News.
Courtney, thank you. State Health Commissioner Dr. Christina Box told Hoosiers the leader of the Trump administration's Operation Warp Speed advised states to anticipate receiving the same number of vaccines for at least the next few weeks. In Indiana, that's between 78 and 80,000 doses per week. We'll keep you posted.
Well, Indiana is distributing the vaccine by age group, as you know, because older Hoosiers do make up the most hospitalizations and deaths, sadly, that we are seeing. To date, more than 9,200 Hoosiers have died from the virus. There are 600,000 cases. The positivity rate and hospitalizations are trending down, and that is encouraging news tonight. But Indiana's top doctor also says we have to stay vigilant.
As we focus on the promise that the vaccine brings, we cannot lose sight of the toll that this pandemic has taken on the lives that have been lost, or on the tools that we have available to us today to help prevent further losses.
We can also tell you tonight, Governor Eric Holcomb is extending his emergency order for the coronavirus another week.
As vaccine distribution continues, teachers as a group still are not eligible to sign up in Indiana. When the state changed its allocation plan, it meant school staff had to wait longer than other groups like first responders. Fox 59's Kelly Rinke shows us how some teachers in Wayne County are still able to get those shots.
Sometimes at the end of the day, the Wayne County Health Department will have unused doses. Health officials here now have about 100 teachers on a standby list, so no vaccine goes to waste.
Anything that feels like a delay in that process is not our preference.
Teachers are waiting longer for the vaccine than originally expected. That's because Indiana announced a change of plans earlier this month.
I can't imagine how difficult of a decision it would be to decide who gets the vaccine.
George Philhauer is the superintendent of Western Wayne Schools. Teachers are not an eligible group right now, but his staff has an opportunity to get a dose. Philhauer got his first shot last week.
We're incredibly grateful that we're included.
The Wayne County Health Department decided to include teachers on a standby list in case there were unused doses at the end of the day.
If we've punctured the vial to give 2 people a dose, then that means we have 8 doses that we have to find an arm to put it in.
Executive Director Christine Stinson says if that happens, they start making calls down the list. The person has half an hour to get to the clinic. More than 25 teachers have received a shot so far.
This was a way that we could have a group that we've already worked with, a group that's easy for us to manage.
People with comorbidities are also on the waiting list. The goal is to not waste a single dose, especially since supply is limited.
These are the kind of decisions that are a punch in the gut. There is a million different ways we could have done a standby list, and each and every one of them would have been appropriate.
They're ready to vaccinate more groups once the state gets a big shipment. Until then, teachers hope this is one step closer to keeping schools open.
We believe that learning happens best when we're in person.
Taking a look at other parts of Indiana, Hendricks County plans to use a waiting list of eligible Hoosiers, and Marion County currently gives unused doses to workers at the Public Health Department. In Richmond, I'm Kelly Rinke, Fox 59 News.
Kelly, thank you so much. Fox 59, of course, getting your vaccine questions answered tonight. In case you missed it, we did have an exclusive town hall event. It was right here at 7 o'clock. We brought together health experts and first responders. We took your questions right to them. Here's a little bit from earlier tonight.
Should one have the swab testing as well as the antibody testing prior to getting to vaccine? And if that is not done, is there consequences of possibly severe illnesses?
So, Dr. Yaletti, does a patient need to confirm they don't have COVID before getting vaccinated? Otherwise, are they at risk?
No, absolutely not. There's no reason to check it. Whether you had COVID or not, the vaccine is safe in both categories. And so the most important thing is to have immunity. And so no risk of taking either vaccine if you had COVID or not have COVID. So there's no recommendation for pre-testing.
How do you keep yourself and your coworkers motivated, especially on the toughest days?
We have to be positive. We have to be positive. We want to see our patients succeed, and we try to put our smiles and we try to be supportive to each other. I need to do a shout out to our RTs, if you would allow me, please. Our respiratory therapists have been amazing, and we just pull each other up. To begin with, I belong to an amazing team of people, and we are all one for each other. We are there to support each other.
And we do want to take a moment to say to all of our frontline workers, our medical workers, our first responders, we appreciate you so much. We are so grateful for your selflessness in caring for our community throughout this pandemic.